Hello, I got a request to do a video on how I clean the G-Tube site, and I figured just to show you, this is a very old G-Tube that I use strictly for demonstration. You can see how stained it's gotten. I haven't tended to it. But if he loses his G-Tube, what I do, the tube will actually just fall right out of the stomach, and down here is a deflated bubble, and this flange would be used to press up against the stomach. So when that happens, you have to act fairly quickly, sterilizing the site. There's a lot of prep work, but basically I take a preloaded syringe with distilled water, put it in here, inflate that bubble down there, and since it's old, it's not really inflating how it should. It would be just a regular, there we go. So see how that's just inflated? So, and then I would check it. I would dip it in some sterile water to see if there's any air leaks coming through. I'd withdraw the distilled water, pull it all back out, bang. And then I would slip this into Ryan's stomach, so his stomach wall would be going around it like this. I would inflate the tube, and it's easier when my hand isn't acting as a stomach, right? I'd withdraw that. That bubble anchors it in the stomach, and I would slide this flange down so that it's secured. See that? And then when I give him his food and water, it's just through one of these ports. I just stick a syringe in there and dump it down in. So that's the basics of the G-tube. So that right there is the only amount that's actually in his stomach. They have other types that'll run into the intestines, and those are for people that seem to throw up a whole lot. But to clean the G-tube site, basic supplies I need: exam gloves, some padding, it's called a drain sponge, Q-tips. I use bacitracin ointment, it's a triple antibiotic. And sometimes I use something called skin prep. It puts a moisture barrier between his skin and the flange, but I don't need to do that because his site looks it looks excellent right now. Washcloth, and then either soap or this no rinse foam that we use. And we use this occasionally to wash his hair or clean around the site. We do this twice a day, but at night it coincides with his bath time. So we clean that site out really well. Alright, so what I'm going to do now is just lift up. Oh, this is like Survivor, man. Okay, so I'm going to just bring this over here. See if I can kind of aim it on Ryan. Ryan, I'm going to try to get your face in here too. What do you say? There we go. Here's the G-tube site. So I take this drain sponge off. Boom. And that's trash. And I don't know if you can see, but there's always just a little bit of residual around there. If there's a lot of residual, then I need to check to make sure that bubble's fully inflated. And with Ryan, we have what's called a Lopez valve up here. I call it a George Lopez valve just because it's funny. And what I can do is turn this valve to do certain things. So I can have just one port open, or both ports open, or both ports closed. This little side port you can use to put in medicine through a smaller syringe, this one. And this one here is the one you use to inflate the bubble, the bladder inside. So here's Ryan's site. It's very clean. what I do is I look for redness, I look for skin breakdown. With Ryan, there's none present. We've actually been told he has the cleanest G-tube site they've ever seen at the hospital. So I'm going to grab my supplies over here. Remember, I'm not going to use the skin prep to put that moisture barrier in. So first thing I got to do is just get my gloves on here. And I don't know how many other parents did this, but when the kids were young and they would go to the doctor, I would always take a couple of these. Yeah, he's got a cough. I'd always take a couple of these gloves and blow them up and make turkeys out of them. And kids would play with them for weeks. Okay, so then I just do a general cleaning of the site, and I could use soap and water. But you got to be careful what kind of soap you use, because you don't really want anything that's going to be too severe. Just come in here and get that all nice and cleaned up. And then I take my washcloth, just wipe it out in there. Did you just yawn there, Ryan? Were you yawning? I wasn't paying attention. Okay, get that site nice and clean. Just like that. See, and there does sometimes get a little bit of debris, and that's the importance of doing it twice a day. And that's at least twice a day we do that. Okay, next thing I do, I get a Q-tip and some of this bacitracin. I put a liberal amount on the Q-tip. And I just come right in there and I scrub it around the site like that. Okay, and by now, really shouldn't be getting anything out of there. So, we get the drain sponge. Now, if he were having skin breakdown prior to putting that bacitracin on, I would have sprayed on some of this skin prep right here. But his site's in excellent condition. So I open this up, and this provides padding between the flange and his stomach. It's, you know, some sort of rubberish type of material, so it would irritate him. There's two that come in it, and I alternate the directions. So I slip it in, so the slit's now on this end. Get the other one, and I reverse the direction. Right there. This will also absorb, not only does it keep the flange from rubbing his stomach, it'll absorb any sort of stuff that leaks out around the tube. My final process is I get a piece of tape, medical tape, and I tape that together so that it stays in place. So there you go. Ryan's got his G-tube site cleaned out in extra time today. Do that twice a day. And let's just tip his head up here. Ryan, why don't you take a look here? Yawning. Take a look over here into the computer. Say hi. Looks good, doesn't he? Doing really well. Doing really well, and he's sporting a shirt for his own cause today. Alright, so I'll go ahead and put that out. I hope that helps the fellow that asked how we clean the G-tube site, since his son tends to bother him a bit. I've heard in conscious patients that it is something that's really bothersome, and they try to pull it out quite frequently. Alright, Ryan, let's go ahead and put this out on you.